Hello, everyone, and welcome. My name is Adele,
I'm Betsy.
I'm Dara.
Hi, I'm Julie.
And I'm Valda.
and our presentation is entitled Understanding How Trauma Impacts Parenting and Relationships with Children. We are all students at the University of San Diego studying counseling. So our agenda. We will begin with an introduction to generational and historical trauma, and then move into trauma symptoms and management. So that will be how trauma might impact you individually and how you can manage any symptoms as they arise. We will then go into trauma, parenting, and emotional regulation. So how trauma might impact you as a parent and what are some emotional regulation skills. We will then move into trauma, relationships, and coping. So how trauma might impact our relationships with our children more generally, and some coping skills for when those symptoms arise. We will then end with key takeaways and positive outcomes. And I just want to name that this content can be distressing, particularly if any of it is resonating with you, if these are experiences that you have had. You might find that this is difficult to hear or to take in at a certain point in time. So we just want to invite you to take your time with this. If you need to pause at any point, take a break, come back to it, or fast forward, please feel free to do so. This video is for you to use as you need to. So please take care of yourself throughout. Even beginning with the introduction to generational and historical trauma, as you're kind of hearing what those concepts are, you might find that those are experiences that you have had and that they're difficult. So please feel free to pause at any point and come back when it feels safe to do so. Okay, so first of all, what is trauma? And I will just give us a few minutes to pause and think about that, what trauma means to you. And so the American Psychological Association defines trauma as any disturbing experience that results in significant fear, helplessness, dissociation, confusion, or other disruptive feelings intense enough to have a long-lasting negative effect on a person's attitudes, behavior, and other aspects of functioning. So I just want to give some clarity on the word dissociation. That is a clinical term that describes a feeling of being separated from your body or from your surroundings. That is a way that our body might respond to intense stress, and it is done, and our body does it to keep us safe when we're in a situation that's too stressful to be present for, but at the same time, it can be very distressing to experience dissociation. Traumatic events can include those caused by human behavior, such as assault or war, as well as by nature, an example being an earthquake. And they often challenge an individual's view of the world as a just, safe, and predictable place. So it is important to note here that not everyone experiences an event as traumatic. Many people could experience an event, and not everyone will develop those trauma symptoms. So it is a very unique and individualized experience. Okay, so moving on, what is generational trauma? And here again, I just want to pause. If as I'm reading this slide, you recognize any of these experiences as something that has happened to you or that occurs for you, please know that as we go on, we're going to talk about coping skills and ways to heal and even thrive having experienced this. So generational trauma occurs when the descendants of a person who experienced a traumatic event show emotional and behavioral reactions to the event similar to the person who experienced it. And those reactions could be shame, low self-esteem, hypervigilance, dissociation, or anger outburst. Here I'll again describe hypervigilance. It's a clinical term, but it describes a state of constantly being aware that a threat could happen, kind of always being alert and concerned that there's a danger near. An example might be going for a walk and always looking around, checking your surroundings to make sure that there's nothing dangerous around. That's again a way that our body is trying to keep us safe, but is very distressing. So generational trauma, it's important to know that it's trauma that is not experienced by, it's when a person who did not experience a traumatic event personally has the symptoms of trauma. So there is still much to learn about how the trauma is passed on, but it seems to be related to relationship skills, personal behavior, and attitudes and beliefs that impact future generations. When I talk about relationship skills, an example might be that if a caregiver or parent has trouble forming and maintaining relationships, they are modeling that behavior to their children or people under their care. So those young people might also have that same trouble. The same with personal behavior. An example might be those anger outbursts. If that is modeled, then young people might also have those anger outbursts. Beliefs that impact future generations could be a belief that the world is unsafe. So if a caregiver or parent holds on to that belief system could be internalized by a young person. Once again, I'll just reiterate that if you have experienced any of this, it's not your fault. It's a very normal reaction to trauma, and there are ways to heal and thrive. Next slide. So moving on, what is historical trauma? Historical trauma is a specific type of trauma that is experienced by a specific cultural, racial, or ethnic group, and it's specifically related to a group's experience of oppression. Some examples would be the indigenous people being removed from their land during early colonization in the United States, a history of enslavement and institutional racism ongoing today. An example could be World War II and the Holocaust, or the disability community being exposed to forced sterilization at different points in time in the United States. The way that this kind of trauma can show up ranges from potentially cardiovascular disease to other trauma experiences, like I mentioned earlier, such as shame or hypervigilance or dissociation. Once again, not everyone who has experienced this kind of historical trauma or has that in their family history will necessarily have these symptoms, but they can show up, and if they do, they are not your fault. They may be experienced alongside generational trauma. So similarly to how we discussed, generational trauma occurs, maybe someone who has experienced historical trauma will have those anger outbursts, and that would be modeled and could create some generational trauma. But alongside that, there can be a sense of damaged cultural identity. An example, again, being Indigenous or Native American people being made to leave their native lands. And just once again, I'll reiterate that the trauma doesn't have to be directly experienced to feel its effects, much like generational trauma. And then I will leave with a definition that was created by an Indigenous researcher on trauma, that it is the cumulative emotional and psychological wounding over the lifespan and across generations emanating from massive group trauma experience. And then we will now share this video. I just want to let you know that although it is called What is Generational Trauma, as counselors, we would usually describe what they describe, we would call historical trauma rather than generational.
Lots of things get passed down through generations. Stories, heirlooms, genetic traits. A new field of study is suggesting that even trauma may be passed down through the generations. Let's dive in. First, what is generational trauma? Well, it's exactly what it sounds like. Trauma that isn't just experienced by one person, but extends from one generation to the next. Here's child-adolescent psychiatrist Gayani De Silva to help explain.
If you have somebody in your family history who has suffered some sort of trauma, let's say racism or slavery or being the survivor of the Holocaust, that experience in your ancestors does get transmitted from one generation down to the next generation, to the next, and to the next, and to the next.
The concept was first recognized in 1966 by Canadian psychiatrist Vivian M. Rakoff. Rakoff and colleagues recorded high rates of psychological distress in the children of Holocaust survivors. A 1988 study found similar results with the grandchildren of Holocaust survivors. Since then, their descendants have been the most widely studied group, but in theory, any type of extreme, prolonged stress could have adverse psychological effects on children and/or grandchildren. How do health experts spot the signs of generational trauma? There are actually quite a few ways it could show up.
For when you're sitting with a patient, you would look for their specific signs of trauma. So you would look for mood issues or anxiety issues. Those are the primary big symptoms that people typically present with. And then you want to do kind of an investigation of why they feel depressed or they feel anxious, or they're having some mood issues, and then you start to ask, why do you think you might be so depressed? Why do you think you might be so anxious? When did that start? Has it always been there? And so when people say, yeah, I feel like I've always been anxious, I've always been kind of depressed, and my mood has always been sort of irritable ever since I was a little child, then the lights got to go off in your brain. You got to think, oh, I wonder what happened before they were even born. I wonder what happened with their parents. Did any of your parents feel depressed or anxious? And then we'd ask about that. And then we'd say, oh, how come they felt depressed or anxious? Were they ever victims of trauma?
Even with all those symptoms for health experts to consider, there's no specific diagnosis for generational trauma, according to the DSM-5, which is the standard classification of mental disorders used by mental health professionals. But the phenomena of intergenerational trauma is well accepted.
It's a learned thing that your brain actually learns, and then the DNA actually learns it and then turns on certain DNA sequences versus other sequences, and it affects brain development. It affects how you learn how to regulate your mood. It affects how your limbic system, which is the part of your brain that is involved with managing emotions, how that develops. And it also has implications on how you react to stress.
Unfortunately, there are no easy answers, but generational trauma can be resolved if a holistic, intense intervention is put in place. This often involves individual therapy, though group and family therapy is another option.
Depending on how severe their symptoms are. So if they're anxious all the time, they're having panic attacks and they can't seem to function as they would like to function in their daily life, we might try medication. So something like a selective serotonin reuptake inhibitor. These medicines are like Prozac, Lexapro, Celexa, Zoloft. Those are kind of the common ones. And we would also highly recommend and want our patients to be in psychotherapy, because psychotherapy is going to help you understand where that anxiety is coming from, where that trauma is coming from, and help you put it in a way in your brain so that you can deal with it, you can handle it, and so it doesn't manifest in symptoms.
If you think you may be experiencing generational trauma, seek help from a behavioral health provider.
So as you can see from that video, one of the main components that they talk about is medication management and even the benefits of psychotherapy. I do want to point out that those two things aren't always accessible, and there's, of course, both cost and time that come with both those options. So although those are two that we are highlighting in that video, we actually are going to explore a lot of other techniques and options in being able to support victims of trauma. So in this next section, I want to focus on how does trauma affect the person who experienced it? And I'm going to break it down with the 3 E's. So event, experienced, and effects. So first we have the event. So here is an extensive list of different types of events. I do want to note, though, that although there's a few events listed here, this doesn't encompass kind of all the events that could be connected to trauma, because it really, as Adele said earlier, it's based on that person's individual experience. So we have here listed human trafficking, sexual abuse, physical abuse, emotional abuse, neglect, serious accidents or illnesses. This could also involve medical trauma, being a victim or witnessing IPV, being a victim or witnessing community violence, school violence, natural or man-made disasters, forced displacement, war, terrorism, or political violence, being the victim or witnessing extreme personal or interpersonal violence, traumatic grief and separation, and system-induced trauma. So again, these are some examples. And as you're going through this, if you need a break, this content can be a little bit heavier as we're kind of focusing on some of these events. So please be kind to yourself. If you need to pause or come back to this, this recording will be here no matter what. So the second E is experienced. So This is focused on the notion of what I just spoke about briefly, that each traumatic event would be different for each person, and the meaning that they are able to put on that experience. So that can be how an individual labels the experience, how they assign meaning, how it disrupts their well-being and their life at the time. Some factors of this could be cultural beliefs, including even gender roles. It also could be the availability of support. An example of this could be two people experience an event. Maybe one person has a robust amount of support right after the fact, and the other has absence of support. So they're unable to have that support to kind of be able to cope with this experience. So that can be an example there. And then also the developmental stage. So really the age of that human when they're having this experience. So again, zooming out of how, although there's these list of events and different things that can happen, it really varies person to person of what their experience is. And with that goes into effects. So there can be lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. So as counselors, we often talk about the biopsychosocial spiritual model. And really what that is we want to focus on how holistically, how an event or how any situation can affect the human as a whole. So really focusing on all of these elements. And sometimes these effects, they might not be right away. There could be an event that has happened years ago, and there could be a delayed onset, could even be possibly as parents, whether it's having a baby or our children hitting milestones. Sometimes we can feel these effects later on. And I want to note here, if we do feel these effects, it's nothing that any person should ever be ashamed of or feel guilty about. Again, it is something as a result of something that's happened to you, and it does not define you. And we're going to kind of go through some of these things of how we can really just focus on limiting and coping with the effects once they come up. So here are the 4 types of symptoms related to PTSD. And the first one is reliving the event or re-experiencing symptoms. So some examples of this could be nightmares, flashbacks. So you could be having a moment where you feel like you're going through this event again. It could be as simple as a certain smell. So it could be like a certain perfume, or it could be a plant. It could be something that brings you back to this memory. And this all kind of goes within reliving the event. And the next one is avoiding things that might remind you of the event, which I think when we hear this, it sounds like a very natural response of avoiding situations that might bring back some of like what we mentioned before, like these flashbacks or the nightmares. So in doing so, the avoidance behaviors might be avoiding crowds because they feel dangerous. You might even not want to drive, say if there's a past experience with a car accident. So these are some of the ways that symptoms can actually show up in our daily life if you've been impacted by trauma. So I'm going to go into the next slide. A moment. Okay, so we have another symptom can be having more negative thoughts and feelings than before the event. So say there's an increase of negative feelings that you're noticing that you're having that maybe you didn't have prior to this traumatic event happening. So it could be that maybe when you're trying to think of this event, it's really hard to kind of put the pieces together within your memory. You could feel foggy. The story might feel fragmented, where some parts feel really clear and then other details are hard to recall. That's very, very common. And then the fourth one is feeling on edge or keyed up. So it can be almost like a hyperactivation where you're having a really hard time sleeping. Maybe you feel restlessness. It could even be you're trying really hard to get a task done throughout the day, whether it's around the house or at work, and you're having some trouble concentrating. This is a very common symptom that can happen that's related to trauma and PTSD. So next, I'm going to focus on intervention and skills. Because again, as we're going through all of these symptoms, can be kind of heavy thinking about how they show up in a victim's life. And we want to focus on kind of what it looks like to being able to like increase some tolerance and feel better. So one of these ways is talk therapy, as we saw in the video earlier, as well as medication. There's a certain therapy called EMDR therapy. A lot of the times we talk about trauma-informed care, which that can be within therapy, but having a professional that focuses on trauma-informed care as their specialty. And then there's other things that kind of are more accessible that you could maybe even look up on your phone or look up videos. It could be a yoga video or doing a yoga class. And then lastly, mindfulness. So we're going to go through some more exercises regarding mindfulness, since that can tend to be a daily practice that is accessible. So I'm going to end this section with a grounding activity. And I want to remind everyone that this video is here to come back to. So if you want to fast forward right now, if you don't have the time to do this exercise, it'll probably take about 5 minutes or so. That's completely fine. You can always just come back and do the exercise when you're ready. So within this grounding activity, let me just start it so I can walk you through it. Excuse me. So this can be a really special technique when you're in a situation where you're feeling any of the symptoms that I listed before. So maybe feeling a little bit of that restlessness, you're feeling more anxious, on edge. The importance of this is trying to figure out how we can ground you to the space around you and calm some of those senses. So without further ado, if you can kind of sit in a comfortable space, I'm just going to go through this exercise. So the first part is I want you to focus on 5 things you can see. So if you can look around your space and identify 5 things you can see, I'm going to give you a few seconds to do that. Okay, and you can actually, for this next one, once you do the exercise, feel free to just press play and we can do it that way. So now I want you to focus on 4 things that you can feel. So feel free to pause the video, look around for 4 things that you can feel, and then press play. So next we have 3 things you can hear. So I want you to take a moment to really listen and identify 3 things that you can hear. And then once you do that, you can press play for the next option. Okay, and now I want you to focus on 2 things that you can smell. Feel free to pause and then press play when you're ready. And lastly, I want you to focus on 1 thing that you can taste in your immediate environment. And please press play when you're ready. So what this does is we're identifying things in our environment to kind of slow our heart rate down, relax your body, and make it so that you feel very grounded and present in that moment. Thank you for doing this activity with me. I hope it was helpful, and feel free to even take a screenshot of it or take a picture if it's something that maybe you would find helpful going throughout your day. Now I'm going to change that.
Okay, so I will be talking about trauma effects on parenting. So the effects on parenting that trauma can have are, it can impact mental health and emotion regulation. And what I mean by emotion regulation is the ability to recognize your own emotions that you're experiencing and be able to regulate them in a way that is not destructive, but more in a way that can ground you. And the inability to do that would be called emotion dysregulation. So when you have emotion dysregulation, it can be very difficult to recognize the emotions you have and be able to identify where they're coming from, what kind of things are contributing to them. And it can also be difficult to even understand what's going on. You might be feeling it in your body and not have the ability to recognize it, which can really affect the way that you go about your day and the way that you interact with your children or family or anybody else around you. And this is, again, to reiterate that it's not your fault. There's many reasons that there are ways that you can change and start to recognize your emotions, but it is something that it can be really difficult because of trauma that was experienced prior. And so this also can have impacts on your ability to express warmth to your child. There can be difficulty in engaging with your child. There can be difficulty with your mood and irritability. And this also can have effects on playful interactions with your child. So the other effects that this can have with children is this can be associated with poor emotional and developmental outcomes in children. And this also, this can also could have had an effect on you as a child if you also had a parent that maybe experienced trauma, which is what happens also in adulthood, and it can carry on. And so this is why we have this presentation to talk about ways to recognize these things in yourself or maybe even in your own childhood. So again, children can experience difficulties regulating their own emotions if they are seeing that their parent has difficulty with this as well. And this can impact cognitive and social development and relationships to others. So some skills that you can use to better recognize your emotions and regulate them. You can kind of take a step back. Let's say you've had a long day at work, or just something about your day was really difficult and you're finding yourself stressed or anxious. Take a step back and just learn to observe what's going on. So kind of recognize like what's going on with your emotions, what's contributing to them, and just naming that what you're feeling. I'm noticing that I'm feeling stressed. I'm noticing that I'm feeling really anxious. I'm noticing that my shoulders are tense. Any things like this can actually really help in identifying what the emotion is and what possibly is contributing to that. So this can help a lot with regulating your emotions. And then another skill that you can use in regulating your emotions is checking the facts. So when you have a situation where you do feel maybe some intense emotions around, taking a step back and just thinking about, is there another way of thinking about this emotion? Learning to observe it and just being mindful of that emotion and maybe an alternative way of thinking about it can really help in regulating your emotions.
Okay, so now I'll focus more specifically on how trauma can influence parenting, specifically with the relationships between, caregivers and children. And so it's just important to recognize that parenting in whatever capacity that is, whether it's a biological child or a caregiver for, an adopted child, I recognize it can be all different situations, but if you're in a parenting role, however that looks, that relationship can really trigger different traumatic memories, either in yourself or in your own child. A child needing you for certain, different essential needs or attachment needs can trigger your own, unmet needs growing up. And that can be really difficult to kind of grapple with. So just recognizing that this, normalizing it, this is normal, and kind of like what Julie was saying, learning to recognize and just build some insight into what's activating us or what's making us a little bit more emotional within the parenting relationship. When we do get activated, this really happens in our nervous system, and this can make it really hard to stay present and to show up fully for, our kids and our families. We might start to feel this in different parts of our bodies, and it might not even be something that's known to our consciousness. We might not really have, the understanding of what's happening, but it's a felt sense of what's happening. And that can be really scary. And it can really affect your ability to show up in ways that you want to. And so even recognizing that is great. And we're going to talk about some ways to, try to ground yourself and kind of rise above it. So this is just a list of things to look out for. These are some emotions, some bodily sensations that you might experience what I'm talking about. So some emotions to look out for: anxiety, despair, shame, irritability, rage, panic. In your body, it might be felt as an increased heart rate, tightness in the chest, a restlessness where you might be tired, but you can't really sit down to relax. You just need to keep moving, or different, parts of tension within your body. And so dropping in and learning how to notice is kind of the first part. When we know what's happening, it can't be as scary. So just naming it can get rid of a lot of the fear of the unknown. And then this is a picture depicting what we like to call the window of tolerance. And when we talk about the window of tolerance, we're talking about our capacity to handle stress. And this is unique to each person. Everyone's capacity is different. It can be influenced specifically by trauma or even by daily stressors. So trauma and increased stressors can decrease our, window of tolerance, decrease our capacity to handle stress. You'll see in the middle, it's kind of like, this picture is kind of putting the window of tolerance into an ocean metaphor. So we'll start in this safety zone in the middle, kind of the top of the ocean where it's nice and warm. The sun is shining. There's a lot of different wildlife, marine animals. This is called the "you got this" zone. We like to call it the safety zone. It's where, you're at your best. So you're experiencing emotions like joy, mindfulness, happiness, being present in the moment. It's kind of where you're grounded, where you feel safe. When something might happen throughout the day, it could be any level of stress. It can be a small stressor, it can be a huge stressor. That might be enough to bump us up out of our window of tolerance, so into our hyper arousal. So that's this where the different weather patterns are, things are changing. That can be called this fight or flight reaction. We feel in danger. So there's agitation, there's anger, there's some panic, fear, crying, kind of like that, needing to flee to find safety. And kind of like what, we've been saying, it's just starting to gain that insight into when these emotions come up, maybe recognizing, I'm bumped out of my window of tolerance. Other signs to look for when we, look at the bottom, that's that hypoarousal. So that's more of the freeze, shut down, threatened feeling. That's kind of depicted in this picture by the dark, kind of cold part of the ocean, not much, life around us. That's going to show up as things like numbness, shame, maybe depression, hopelessness, detachment. Maybe we're withdrawing from other people. Maybe we just feel really tired and unmotivated. So that's another sign that we've been bumped out of our capacity to handle stress. And then once, we recognize, okay, I'm out of my you got this zone, I'm out of safety, how do I get back? We can use Betsy's 5, 4, 3, 2, 1 grounding exercise, noticing what's around us in the room, coming back to the present moment. It could be other grounding coping skills that are specific to you. I think the main thing with all of these is what works for you. We're going to throw all these different tools and tricks at you. And if it doesn't resonate, we invite you to leave it, but we invite you to take what does work for you. So the key here is just finding, getting to know yourself, what relaxes you, what makes you feel full, what makes you feel cared for, how do you self-soothe? That's going to be what you want to take out in moments of getting bumped out of your, safety zone. And then also just to note one thing, sometimes it's not possible, to always, whip out the right coping skill. Sometimes situations happen. And then that's that self-compassion. Like there's always next time. Can't get it all the time, but it's just wanting to, try harder next time, or just small improvements. These are really difficult things to recognize. So other ways to manage some of these triggers that might come up in yourself through the parenting relationship, or if you might notice it come up in your children. One is to just listen. So listen to yourself, notice what's coming up for you, and then honor what's coming up for you. So acknowledge, maybe there's some acceptance of just what your physical experience is, what your emotional experience is. The first part is just to really take note. Then, as Julie explained, to try to regulate as best you can. That's going to look like you're responding rather than reacting. So rather than just letting your emotions, drive your behaviors, what are ways to really slow down and then maybe respond in a way that you kind of want to, more than, how your body is just reacting. This could look like, moving your body, breathing, yoga. These are some things that work for people, and just trying to be emotionally and physically present in our relationships in the moment. A third suggestion is to not take, behaviors personally, specifically from youth or children. The parenting relationship is super complicated. And so sometimes recognizing that in the caregiver role, not everything is a direct reflection on us. And that's, takes practice maybe, or just some more, self-compassion or awareness that, it's a difficult role, and not everything is a personal, insult or attack on you, and how to maybe look at things a little differently. And then if things are getting really hard, seeking help. You don't have to go through this alone. We mentioned counseling in the beginning, also though cultivating community. So surrounding yourself with people going through a similar experience in similar situations can be really helpful. And then another helpful skill is called co-regulation. So we're talking a lot about emotional regulation in ourselves and how that can lead to, influences on our children. And so there's a way for us to kind of be in this co-regulatory process through caregivers and youth, no matter what age. And so when we talk about the co-regulation process, we're talking about the supportive process between caregivers and children, youth or young adults, that really fosters self-regulation. And on the right, you'll see 3 overlapping circles, because co-regulation happens in 3 overlapping processes. So the first one is providing a warm, responsive relationship. This looks like displaying care and affection in ways that recognize different cues and signals from the youth and what they need and want. So you can do this through communicating words or actions, your interest in the young person's world, your respect for them as an individual, and really showing a commitment to caring for them no matter what. So we call this an unconditional positive regard, really being like their biggest cheerleader and advocate through all things that might come up. The second piece is structure the environment to make self-regulation manageable. So this is creating an environment that's physically and emotionally safe for youth to explore and really learn at their level of development without any serious risks to their well-being. This will look like consistent and predictable routines and expectations, really promoting a sense of security through, clear goals for behavior regulation and well-defined, logical consequences for when there are negative behaviors. And then the last piece is teaching and coaching self-regulation skills. So this is done through modeling, instruction, giving opportunities to practice, and then reinforcing each step. And so it's helpful to look at yourself like a coach on a sport team. You're first teaching these skills, and then you're provided the needing supports so that they can be used in the moments. So these are kind of like muscles that we use and we build and strengthen. And then lastly, I'm going to go over another kind of co-regulating technique, which is grounding touch. This is a technique to soothe different age children and to promote secure attachment. These can be defined as small gestures throughout the day to help, youth calm down their nervous systems and stay connected and really build a secure sense of attachment with the caregiver. And I just also want to note that these skills can be used with any age at any time. A lot of the youth in the video are pretty young, but I think that it's adaptable to all different ages. And you can even use it with yourself, kind of what I mentioned earlier about self-soothing. I think even applying this to personal touch to ourselves can be really useful.
I've spoken before about the social engagement system, which is our nonverbal capacity to transmit safety and connection to another person. And the behaviors that we do nonverbally, they are transmitted non-consciously to the other person that we're trying to communicate safety and connection to. And of all of the aspects of social engagement, touch is the most powerful. And I want to talk about touch and using touch in parenting. So when you have a baby, it's so natural to touch an infant and toddler, and you're always holding and cuddling and tickling and, rocking them and changing them. And as they get older, we kind of lose those opportunities. Certain kids more than others really need grounding touch, and they benefit from it just throughout the day. So not a formal kind of, okay, now I'm going to give you a massage or come in for a hug. It's more that like when you go to the kitchen and you're in the fridge and you're going to pass them something, they're sitting at the table, you put down, let's say the ketchup bottle, but you also put your hand on their back for a moment or on their arm, real casual, and then move on. Another thing is sitting on the couch with them, that if you really sit like shoulder to shoulder, like thigh to thigh, or even have their foot and cradle their foot, that's the kind of grounding touch. If you have a kid who's acting really squirrely or, silly, and you make them a little cocoon in their bed with heavy pillows, that's grounding touch. And also an idea is to make them into a pizza or a sandwich with pillows and have them be underneath and say, now I'm going to put some lettuce and then I'm going to press it down and press it down and press it down. Okay, now I'm going to take some salami and I'm going to put it down. I'm going to press it down and really make that nervous system calm down from the touch. That's the kind of thing that I'm talking about. So it doesn't have to be as overt as like affection, but it is trying to find occasions to get that body sensation of like, you're grounded, there's definition around your body. And that, especially with kids who have a lot of sensory needs, it's going to be really important for you to find lots of different ways to provide this kind of grounding touch to say, I'm with you, I'm connected with you.
Going into this last part of the presentation, I wanted to just kind of highlight some key takeaways from what my colleagues have already talked about. When we talk about how trauma can possibly affect like an individual as well as like beyond them in their relationships, I think it's important to highlight again what generational trauma is, as well as what historical trauma is. So again, generational trauma occurs when descendants of a person who experienced a traumatic event shows reactions similar to the person who directly experienced the event. And historical trauma relates to a cultural, racial, or ethnic group's experience of oppression. And the effects of historical trauma, direct experience is not required in order to feel that kind of impact. When it comes to parenting and caregiving, this can bring up like traumatic memories and reactions within like either the parent or caregiver or within children. And when it comes to children, this can look like children behaving in the same way as their parent or caregiver. So this can look like similar or same symptoms. Children feeling like they have to mature more quickly in a less like stable environment, and our problems with like emotion regulation, things at school academically, and relationships. I know that this was a lot and the topic's really heavy, and at the same time, like we really wanted to highlight that there are ways to manage symptoms of like PTSD or post-traumatic stress disorder, or like things like symptoms that come up from stress. And this looked like some of the examples that my colleagues brought out, like this idea of grounding techniques, going to therapy, things like that, and also like co-regulating with children. And so like, again, to kind of reiterate some of the points that were already brought up, as well as to add on, here are some ways to kind of break that cycle of historical and generational trauma. So the first thing is, one thing is to really find support for yourself, because this can be like kind of the foundation. So what this looks like is instrumental and emotional support from other adults. Doesn't have to exactly be a professional, could be like a friend, could be like a relative. Community support, so looking for community resources, support groups, or like professional mental health treatment. So like going to therapy, individual or group. And in this way, like being able to process trauma through like being able to tell your story within a professional safe space. And also like doing things like practicing some self-reflection, self-compassion, as we mentioned before, and some self-care as well. And all of this is individualized, right? Like looking at like what you need in the moment. In terms of like working with children, so here are some strategies with like parenting. So there's some overarching themes, and I believe some of these were already mentioned in the presentation. So this idea of promoting safety through careful consideration of environmental exposure and conversations. So this can be like a safe home environment. It could be something like modeling healthy relationships, so showing like respect and everyone's needs being met and listened to. And it could also be something more practical, like not allowing drugs or alcohol within the home. Safety would also include conversations with children about like dangers of things like abuse, and teaching them to talk with someone they trust if anything were to happen. The second theme is this idea of being a responsible, not perfect parent. So this idea is that you want to practice some self-compassion, so that you're not like, you're acknowledging your own efforts and achievements as a parent, rather than demanding yourself to not be able to make mistakes. And this idea here is that a lot of times with growth and development, children also need to have that opportunity for some independence and autonomy. And so giving them that room for to make growth, to grow from like mistakes and learn from mistakes, can be really helpful for their development. And the last theme is this conscious, purposeful, and deliberate decision making. So kind of like we mentioned a little bit, building this awareness around like our responses, and kind of seeing like, oh, how can we intervene? And one way to do this is with the family cycle, which I will walk through. So the family cycle was used in this study with like a parent and child kind of pair. And the family cycle is basically this clinical activity that's designed to kind of promote this idea of being able to build this awareness around how like our internal cues kind of interact with like external cues, and like how our past experiences affect our perspective of the world around us and our interactions with others. And so in this study, they had used the family cycle to kind of help lay out these kind of processes with parents and children who have had histories of significant and often chronic developmental trauma. So I'll walk through kind of like this layout. So the first part is kind of being able to name the loss or pain that was felt due to like the traumatic event or the chronic stress that came up. For this particular study, they reframed this within the context of like a problematic parental relationship. So this could be like just kind of having some trouble with like parents themselves in general, or dysregulation within parenting and how that kind of affects the child. And then so with that, the next step is identifying this unexpressed belief. So kind of just this idea of like, oh, how did this adverse or like hard experience, like what kind of perspective or lens are you now looking at the world through? And then after that, the next step is kind of exploring how like this daily life of the individual who's filling out this family cycle like further confirms their negative belief, which is oftentimes connected to their relationships with their caregivers. And then next is kind of like, well, how did they respond to this dynamic with their caregivers? So this can look like, what are some coping skills they use to kind of help with like the chronic stress, or what emotions came up. And then after that, it would be, the next step is kind of considering like, well, what is their caregivers then response to kind of the ways that they cope or their emotions. And then the last step is looking at, well, has there been a time where all of this has kind of come together to create this like point of crisis or intense difficulty, and then how that kind of plays back into this loss and pain that is felt with adversity or trauma. So on the next slide, I have an example from that research article where I had pulled the family cycle, and this was going through kind of what a parent was going through when they were younger with their own parents or caregivers. So in the first one, they had this like loss and pain was identified as no one protecting me. And this led to this unexpressed belief of I should have never been born. And then the dynamic that they had with the parent had with their caregivers was feeling like they had to walk on eggshells at home. And the way that they kind of cope with this was holding in their shame and making themselves very small at home. There are also times they also ended up dropping out of school and spending most of their time on the streets. And how their caregiver responded to this was that like their silence at home made them an easy target for their dad to put them down. And this kind of all culminated into them like moving out at 15 years old. And then they kind of identified like saying, oh, that they had a lot of messed up relationships and had to move around from shelters from then, which then kind of feeds back into this loss and pain of no one protecting me. And then so that was like, so the study had parents do this cycle, and they also had about their own parents, and then they had children do like their own family cycle regarding like the parents involved in the study. So the next slide shows the family cycle that was filled out by the child of the individual who had filled out the previous cycle. So this is kind of based on the child's perception of their relationship with their parent. So they thought that their like the loss or pain that they experience is a lot of ups and downs due to having to move a lot and their mom's mood, so the way their mom kind of reacts. And the second of their unexpressed belief was this idea that everything is crazy, which the clinicians kind of reframed as like nothing was predictable. And then this third part is that they said that they didn't know what they were going to get in terms of the dynamic between them and their parent. And then how they kind of reacted is that they had two attitudes. So if things were calm and stable, then they would have a good attitude. And if things were loud and their mom was moody, then they would have a bad attitude. And they said how their mom kind of responded to their attitudes was they identified it as like mom gets angry, which the clinicians kind of reframed as like mom disrespects me. And then how the child said like the point of like crisis or intense difficulty is when they said I go crazy, which is this idea of like externalizing behaviors, so like showing like aggression and things like that. And so after kind of getting the family cycle from both the parent and the child, the clinicians then overlapped the cycles together to kind of show like how these processes can parallel one another and overlap. So you can kind of see here that there are a lot of different connections that kind of make sense in terms of like, oh, how a parent experiences like caregiving or like their chronic stress from like their generation kind of falls through to the next generation. And the reason why like this can be helpful is that there's a lot of it's like building awareness, right? Because a lot of times like it's not exactly like anyone's fault that these things like kind of reinforce and occur. The idea here is that when we build awareness around how these processes are happening, we can find places to intervene, which kind of goes to this next slide of talking about coping strategies. So when we lay out the family cycle and there's places we can see where there might be some dysregulation, then an individual coping strategy is practicing some paced breathing. So this can help with like activation symptoms. And I have like, the steps laid out here. So if you want to take a pause and like practice it yourself, feel free to. If not, like that's okay. Like we mentioned, this presentation is here and you can always come back. Another intervention that can be done with another person, whether that be like another like adult support or professional, is to challenge like negative thoughts. So this could be like that unexpressed belief that comes up. So what this kind of looks like is like writing down a list of negative thoughts that can bring up like uncomfortable or unwanted emotions. And then the example is like things will never get better. And then have like another person say these thoughts to you, and then being able to like physically push against the hands of the person who had said this and speak back to them in a strong tone with a self-affirming statement. So for example, you're wrong. I have survived hard times before and I will survive this too. So kind of like highlighting like your strengths and being able to kind of physically push those thoughts away. So that's another practice. Okay. And so this next slide, we do have a journaling activity set up. You are more than welcome to take part. If this is like a good time for you. If not, like you can feel free to fast forward and come back anytime. If you did want to participate in the journaling activity, then I would invite you to kind of pause the video for about like 3 to 5 minutes and then just like answer some of these prompts and just talk about like what are your strengths as an individual, and if you're a parent and a caregiver, like what are your strengths as a parent or a caregiver. And feel free to pause the video right now and participate. Yeah, so the reason why like I think it's important for us to speak about like our strengths as an individual and as like a parent or caregiver is to kind of really think about like this idea of resiliency, being able to overcome like these difficult experiences and like their impact, and then in that sense generating hope within ourselves. So this was like a quote that was found about this resilience in parenting through like trauma, and so this individual had said the most difficult part was how to love them, referring to their children. This was hard because I never had much attention or love from their own parents. And so this was hard for me. But with time, I started understanding how things were. I remember all the suffering when I was a child, and I don't want to do this to my children. And so this is what makes me be strong and keep going. So there's this idea of like resiliency continuing on. And with that, like I also wanted to bring up the symbol of like a tree, right? So when we think of like a tree, like it has its roots, it has its like inner core, and it has like its branches and leaves and things like that. And then we can kind of think of this as a metaphor for a person. So like traumatic events and things like that can come up where like, you know, some branches might be pulled off, some leaves will be pulled off, things like that. And like, you know, there might be times where the tree might get kind of scratched up and things like that. And yet, as long as it still has like its roots and its inner core, which we can think of as like the human soul, there's always a chance for continued growth. And the tree kind of is resilient through it all. And so that's like the hope for you as well. Yeah. And then, so in this next slide, we have a resource guide with coping strategies. So on one side of the resource guide is like a list of organizations that work a lot with like human trafficking, and they can help provide either instrumental support with resources or just like providing more information for educational reasons. And then on the right side, we have a list of some of the coping strategies that we had talked about throughout the presentation, just so that you can have that with you as well. And yeah. And so we just want to thank you all for watching our presentation. We appreciate how much you want to learn about this topic. We know it was heavy, so thank you. And so with that, we encourage you to share like your feedback with us and give any ideas for like future presentations. And we'd love to hear from you, so feel free to do so whenever at your own discretion. And thank you for listening. Thank you.
Thank you.